If you've ever had a baby or if you've ever been in a delivery room, you know that sometimes it can be really scary. And we are perinatal or reproductive psychiatrists. So we help people who are experiencing difficulty with their mood in pregnancy or postpartum. And today we want to talk about birth trauma to help you understand maybe what is it? Did I have it? What should I do if I do? My name's Dr. Nichelle Haynes.
I'm Dr. Kirstin Lasseter.
And we're medical mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Maybe we should just initially define it, right? So what is birth trauma?
Yeah, so birth trauma is when you've had some sort of traumatic experience around the birthing process to the point that you were fearful for your life or your baby's life or someone else's life. It can also be people who are not the ones giving birth, right? But the ones witnessing the experience happening.
Yeah, of course, yes. I think above and beyond even saying if you felt like your life was in danger, if you felt scared or if things felt really out of control and you didn't know what was happening, I think that can qualify too, right? It doesn't have to necessarily meet that criteria of actually being dangerous. It's more about how it felt for you. And there's a big distinction there.
Absolutely.
Yes.
That's a good point.
It happens commonly, right? I think it's 1 in 3 or 1 in 4 births have some element of traumatic experience in them.
Yeah. It doesn't even have to be that the birth itself was anything different. I've had patients before who felt a certain way after getting their spinal for a C-section and felt like they were going to die. Everyone else in the room, things were going as planned, but to them, it was traumatic and difficult.
And I think that can happen even with just lack of communication. We expect that you're going to feel this way. That this part might be painful, or this part might feel scary, or you could feel hot, or you could feel shaky, or you could throw up at this time, right? There's so many different physiologic things that happen at birth. And if you're not aware or people don't talk to you about what to expect or if it's normal or not, then it might just feel really scary for you, the normal physiologic things that happen in birth.
Yeah, absolutely.
Yeah. So how do you know if you experience birth trauma? If you're the one watching this video, you're like, oh, maybe that's me. What would you say to your patient?
I think that you are the only one who can judge that. It's not something that somebody else can come in and say, that wasn't traumatic. Something being traumatic is a very subjective experience to begin with. So it's all about your perception of the experience. But just because you experienced something traumatic also doesn't mean necessarily that you will develop mental illness from that trauma. So there's a very specific type of mental illness that can develop after birth trauma called birth trauma PTSD or birth-related PTSD. And that can be very difficult and detrimental to a family as they're going through having a newborn, or maybe it was a pregnancy loss that they experienced. And that mental illness complicating everything makes it really hard to process and go on with life.
Mm-hmm. Right. So a lot of births include a traumatic element where people felt, scared, or they were worried for their life, the life of their baby, or, someone else involved in the process. But a much smaller percentage of those people will develop PTSD. So I think it's just important to recognize that it can develop into something that requires treatment or would benefit from treatment, but that's not always the case. I think it would be helpful for us to go through the post-traumatic stress disorder criteria and symptoms so that if you're someone who's like, hey, I did experience birth trauma, is this something that kind of has moved into the realm of illness that needs to be treated? Do I need to be someone who's in that category?
Yes. Yeah.
I'm not saying it right. I'm not saying it right.
But I think just before we get into that too, though, if you've experienced a traumatic birth, it's never wrong to go and get support around it, whether it's like a support group or seeking out therapy for it and making sure that you are kind of processing it the way that you need to. You don't have to necessarily have PTSD in particular to be able to get help for the experience that you had.
Right, totally. I think even it can include just debriefing with your physician or the nurses to talk about like what happened, was that sort of expected, and to just like receive some care in that time.
But debriefing on your own terms. So
Right, totally. Yes.
I think debriefing in general after a traumatic experience, like when somebody else is doing it, can actually increase the risk of PTSD. So waiting till you feel ready to kind of process what has happened.
Right. Yes, exactly. This always should be on your terms. I feel like that just like goes without saying.
Yeah.
But yeah, I think it's important to make that nuance known. Okay. PTSD symptoms. First, you have to have a traumatic event or have witnessed a traumatic event. And you should define what that is. Right?
And then you have to have re-experience symptoms of the event.
Where you're remembering it, you're dreaming about it, you're maybe having flashbacks.
And now like intrusive re-experiences. So it's not like you're remembering it because you want to remember it. It's like this intrusive memory of the event happening or these flashbacks, which I think people overuse that term, but basically flashbacks mean you feel like you are back in that experience all over again. Like in the moment, it feels like I'm right there again. Like this is all happening.
Yeah.
Which is really scary for people.
Right, of course. The next component that you would want to assess is if you're having difficulty with like mood or reactivity or thoughts related to the traumatic event, right? That you're maybe not able to remember parts of it, or you're feeling fearful a lot about maybe even other things, that you might feel detached from others, including baby, especially because there's like a whole complicated thing associated with like this person came into the world when something was so traumatic and they're associated with it. So that's like another nuance to birth trauma related to other trauma, maybe different from other traumas.
And just like feeling depressed and having negative thoughts about yourself or like blaming yourself or having negative thoughts about people in general or the world, like the world is no longer a safe place. Those kind of thoughts can come up that are related to PTSD.
How many times have you ever heard, I feel like I can't trust doctors anymore, or I feel like I'm ruined, or things don't feel safe, I'm always worried now, like kind of the beliefs around themselves can really change.
Yeah.
So often.
And then avoidance is another symptom that can go on with PTSD, and that can be avoidance of even thinking about the event at all, avoidance of the feelings involved with the event, avoidance of maybe it's actual like smells or the way something was touched or things that remind you of that moment again.
Yeah, that's a big one.
And I think something that we don't talk about enough is that avoidance can also be using substances that are helping you avoid, right?
So like 100%.
Alcohol is very common. People will start drinking a lot more alcohol after a traumatic event, or smoking more weed, or anything that kind of helps numb them from being able to process what had happened.
Such a good point. Avoidance can include altering your mood to not think about the things. Yeah, totally. So another like sort of category is kind of being more reactive. So this could come out as being super aware of everything that's happening.
On edge and protective about everything.
You're like, is he breathing? I hear, a dog barking across the street, and I'm like startled. Like an overactive startle response would be one of them. This could be like kind of being ragey or irritable, like kind of this like mom rage thing. I wouldn't say that all mom rage is PTSD, right? But that can be a component of it, of course.
Yeah, because you're just kind of more on edge. You're like almost stuck in this fight or flight mode. And so if you imagine that kind of feeling, it's just like things make you jump, or you're more like helicopter mom, or just more irritable in general because you're so tense and worried.
And kind of in that same category is like you're having trouble concentrating on the things that you need to concentrate on because you're doing all of this around here, checking and looking for things. And then also you can't sleep because you're doing that even when you need to be resting.
Your body's just in that mode.
Yeah. So if a lot of those kind of sound like you, I would definitely reach out for some help, or at least talk to someone about whether you meet criteria for PTSD. But if even some of those sound like you, I would definitely try to get into therapy or talk about it, a group, debriefing on your own terms, and having a place to process what happened.
PTSD is very treatable, and birth trauma PTSD is no different, in that there are medications that can be really life-changing. You always want to be doing therapy in addition to medications for birth trauma, because the therapy component is so important for helping you get past PTSD. But it's very treatable.
Totally. And also, just one other little caveat is, if like regular talk therapy where you like have to go in a room and sit with someone seems like too scary or too much for you, there are other types of therapy. Like you could go for tray therapy, where you like kind of reenact events and you get to like have something here that we talk about, like the representation of this, that, or the other, that it doesn't have to just be like you sitting here talking about things if that feels scary. There's other types of therapy too that you could pursue.
Yeah, I mean, I think one of the ones that has research around it being very effective is something called CPT, which is cognitive processing therapy. And it's very like instructional and kind of didactic in terms of, it's not one where you just go and like talk and you're actually kind of going through like, what are the thoughts and what's the accuracy of those thoughts, and kind of tackling each little issue one by one, which I find to be really helpful for people.
Right, especially if you're kind of like more in the box kind of thing. So hopeful that was helpful for you. Please let us know what you want to know about, because we'll make a video about it if we can, right?
Yeah.
Thank you so much for being here. Like, comment, subscribe. We'll see you soon.
Bye.